In this video, we're going to demonstrate how to assemble an anesthetic syringe. So this is our anesthetic syringe here. These are our anesthetic needles, our anesthetic carpules, and this is our needle capper, which is going to be used to just protect us from poking ourselves. As far as our anesthetic needles go, we have two colors. Our blue is our maxillary anesthetic needle. This is our short needle, and it is going to be used for infiltration. This is our yellow needle, which is our longer needle, as you can see, and this is going to be used for a nerve block and on mandibular teeth. For our anesthetic carpules, there are a bunch of different types of anesthetic. What anesthetic you will use will be kind of depicted on your patient's medical history, medications that they're on, your doctor preference. As you can see, they are color-coded. These are just a few of them. I know a very typical one is the red one, which means it has epinephrine in it. Once again, depending on medications, some patients may not be able to handle or take an anesthetic that has epinephrine in it. So what you will use will be based upon, once again, medical history and doctor preference. So this is our anesthetic syringe. As you can see, this top part has a little screwing area here, and this is where we are going to place our anesthetic needles. In here, you can see that this pulls down, and it has this sharp little point to it right here. So what this is where our anesthetic carpule is going to go. This point here is called our harpoon, which is what we are going to use to kind of place in this rubber stopper to harpoon it to allow this medication to come out through our anesthetic needle. So first I'm going to place my anesthetic carpule. So this part right here is the top of our carpule. It will go up here. This bottom part here is the bottom, which will be harpooned here. When I go to insert my anesthetic carpule into my anesthetic syringe, I'm going to have my two pointer fingers under the wings of the anesthetic syringe. I usually put my fingers and wrap them around the thumb ring here. And with these two fingers, I push up so that way my harpoon comes down, and I pull down with these two fingers. So once again, I'm going to push up and pull down. And as you can see, that will tuck my harpoon all the way in this anesthetic syringe. So that way, when I place my anesthetic carpule and let go, it comes up. And now when it's time for me to harpoon my anesthetic syringe, which I will show you later in this video, I will have properly placed this in here to do that. So now I'm going to place my anesthetic needle on my anesthetic syringe. So I'm going to carefully twist off this back part. Obviously these are clean needles, but still this end here is very sharp and pointy, and you do not want to harm yourself. I always like to have a fulcrum on the syringe. It's just a dental assistant thing for me. You will place and line this up inside the center of your anesthetic syringe and twist to tighten it. Once you have this on and tightened, you will always put your protective little barrier on, whichever kind you use. There are many different ones to protect yourself from the needle. Now, once you have all of your pieces in order and together, you will flip your anesthetic syringe upside down. I always like to hold it like this, kind of in a fist grab, and just lightly with the palm of my hand here, forcefully, but not too forcefully because I don't want to break my anesthetic carpule here. I will harpoon my anesthetic syringe. Okay, so now that it is harpooned, you can see here, our harpoon is now in this rubber stopper here, and it will not come up, which means when the dentist is ready to administer the anesthetic, they will push some force in the thumb and it will come out of our anesthetic needle. When disassembling your anesthetic syringe, it's very important to be careful because this is now a dirty needle. These things are sharp and you do not want to get a needle stick. If you do, you will follow your office's protocol based upon what you'll do, review patient medical history, things like that. So when I go to disassemble my anesthetic syringe, first thing I like to do is take off my needle cap. Very carefully, I twist this off, making sure that I'm not just twisting the cap off so the needle comes out, but I'm actually twisting the end so that way it comes out as one. Once again, with my needle capper on, using a fulcrum as always for stability, I'm going to put this back on, take it out of my needle cap, and then this will be placed in my sharps container. Next, I will disassemble my anesthetic syringe so by taking out my carpule, the same way I demonstrated to place your carpule in. Once again, 2 fingers under the wings. I like to have a few fingers by the thumb ring, push forward and pull down, and it should come out in one piece. And this will also go in our sharps container, and that is how you will disassemble your anesthetic syringe.